Hi, everybody. This is Ellen Schmidt from the Children's Safety Network. I'm the Assistant Director, and I just wanted to welcome you to our virtual bullying prevention webinar that's being hosted by the Children's Safety Network. We're going to feature on this session today looking at the important issue of bullying prevention, particularly to adolescent health, and focusing on the new Title V performance measure that the State Health Department can choose to focus on. So we're going to turn this session over to Rebecca, and she's going to run us through a few do's and don'ts, and then we'll introduce our speakers.
All right, thanks, Ellen. So audio is over the phone. And phone lines are going to remain unmuted for this webinar, so please mute your own phone when you're not speaking to eliminate any background noise. This webinar is being recorded, and we're going to send a recording out to all registrants after the session. You can use this chat box on the lower left-hand side if you have any questions, or you can also ask them over the phone. And a PDF of the slides is available for download right in that file pod that's right above the slide deck. So to download them, you can select PDF of files and then download files, and the files should appear in a browser window. And that's all I have. Back to you, Ellen.
Great. Thanks, Rebecca. Okay, so we're going to start off with Erin Rainey, who is from the Health Resources Services Administration and Maternal and Child Health Bureau, and she's going to lead us off and let us know about the agenda and sort of give us an overview, and then we're going to hear from Dr. Sue Limber from Clemson University. Erin?
Thanks so much, Ellen. Good afternoon, everyone. Really happy to see you here virtually online. Wanted to set the stage a little bit. It's been a while since we've connected together about this issue of bullying as a national performance measure. So to recap, we last connected on December 3rd. You may remember, if you were able to make it, that this was the first virtual meeting of MCH programs that selected bullying as a national performance measure, and as well as your partners, some of you were able to invite and bring to that meeting. We talked together about some top-level analysis of your proposed state action tables and began to look at some of your initial thinking of what bullying means in the lens of a state health department program. And we looked at some themes. We also talked a little bit about your technical assistance needs as you move through these next few stages in the block grant transformation. And we set the stage for a face-to-face skills building session at AmChip. And so we all know about the realities that happen. Mother Nature intervened on us, and due to the blizzard, we're not together in January. And so we've called this meeting today to get back in touch, keep that conversation going. So what you see in front of you now is our intention to, again, do this brief recap. We want to spend some time today getting into the weeds of what are the best practices in bullying prevention. We heard from you in December that you'd like a little bit of insight on whether what's written on paper aligns with some of those best practices. So we'll have a chance to discuss that today. Our colleagues from the Strengthen the Evidence Initiative, Dr. Cynthia Minkowitz, is on the line with us, and she'll be helping kick off that conversation around the crosswalk between what are the best practices and what how that might relate to state or jurisdiction health department work. We're really excited. I think the most important part of this meeting is to open the conversation up to you all, to hear your thoughts, your reactions, and kind of what you think you may need next. We know in terms of next steps after today that you are going to be, many of you, coming together in April 5th and 6th for the peer-to-peer learning and technical assistance event. And so we're hoping to be flies on the wall there and be able to pick up some clues from you about your additional needs. And then we are still going to be holding that skills building session on April 6th. And so whatever we hear from you today will probably inform some of the design of how we approach that. So I hope that helps. At this point, I'm going to turn it over to Dr. Sue Limber, who is going to share with us a little bit about the best practices in bullying prevention, and also what may be more important, what doesn't work. And so as Dr. Limber gets started, feel free to type in questions as we go, and we can try to address as we move through the presentation. Thank you.
Great. Thank you so much, Erin. Good to be with everybody. Apologies in advance for a scratchy voice and a cough, and thanks to Erin, who's offered to jump in case I lose my voice. So if you hear her voice instead of mine suddenly, that is why. As Erin mentioned, we'd like to highlight some misdirections in bullying prevention and response, and also some best practices. In other words, what do we know about what doesn't work, and what do we know about what works to prevent and respond to bullying? I'm going to begin with a discussion of misdirections. In other words, bullying prevention and response strategies that are sometimes used by well-meaning educators, mental health professionals, and advocates, but are not supported by research or by our understanding of best practices. So let's take a look at a few. The first has to do with zero tolerance for bullying. As most of you know, some schools have adopted zero tolerance or three strikes policies towards bullying, in which children who bully others are suspended or perhaps even expelled from schools. And these policies, which are sometimes often called, also called student exclusion policies, raise a number of concerns. First, they potentially, of course, affect a large number of students. We know that substantial number of students admit on anonymous surveys, for example, that they bully other students with some regularity. Second, threats of severe punishment, such as suspension or expulsion, can actually discourage children and adults from reporting bullying, and reporting is key to prevention. Third, bullying can, of course, be an early marker of other problem behaviors. Kids who bully are in need of positive, pro-social role models, including adults and students in their school. Of course, school safety may occasionally demand that a student be removed from a school environment, but these situations should be rare and shouldn't be considered best practice at all in bullying prevention and response. A second misdirection involves the use of conflict resolution or peer mediation to address bullying problems. Conflict resolution and peer mediation are common strategies for dealing with conflicts among students, but in most cases they are not recommended to deal with bullying. Why? Well, first, bullying is a form of victimization, not conflict. Second, mediating a bullying incident can send very inappropriate messages to the students who are involved. So the message should not be, you're both partly right and partly wrong, we need to work out this conflict between you. The appropriate message for a student who is being bullied should be, no one deserves to be bullied, and we're going to see that it stops. Likewise, the appropriate message for students who bully is, your behavior is wrong, and we're going to work with you to ensure that it stops. A third concern is that mediation can further victimize a child who has been bullied. Being bullied can be, of course, a very traumatic event for a child, and forcing that child to face his or her tormentor, or at least encouraging him or her to do that without being well prepared or supported, can re-traumatize the child. A trauma-informed approach is critical, and it should recognize that children who've been bullied may have experienced trauma and really need special care to address the trauma that they've experienced and to avoid practices like these that may re-traumatize them. Now, in some cases, restorative practices, these are practices to try to repair harm and restore relationships, may be appropriate, but they typically require considerable time and training by professionals. These are conditions that are not typical of most peer mediation programs in schools. Another strategy that some schools use to address bullying behavior involves group therapeutic treatment for children who bully, including anger management, perhaps skill building or empathy building, and self-esteem enhancement. And although these are very well-intentioned, these group interventions can often be counterproductive, as group members tend to serve as poor role models and, in fact, reinforce each other's antisocial and bullying behavior. A fourth misdirection involves overstating or simplifying the relationship between bullying and suicide. As I think we're all well aware, recent media publicity around suicides by youth who were bullied by their peers has led many to assume that bullying often leads directly to suicide. And although research does clearly indicate a connection between involvement in bullying and suicide-related behaviors, it's very important not to overstate or misinterpret the extent of that connection. Discussing suicide as either directly caused by bullying or implying that bullying is the only cause of suicide is, of course, not helpful and potentially harmful for a number of reasons. First, it encourages sensationalized reporting. Second, it fails to recognize that the causes of suicide are very complex, and there are many individual, relational, community, and societal factors that contribute to risk of suicide. Third, it perpetuates this false notion that suicide is somehow a natural response to being bullied, which has the very dangerous potential to normalize the response and may even lead to suicide contagion among children and youth. A final misdirection that we wanted to highlight involves implementing simple, short-term solutions to prevent and address bullying. For example, sometimes school administrators and their staff adopt a very short-term, piecemeal approach to bullying prevention. It may be the topic of a staff in-service training, perhaps, a PTA meeting, school-wide assembly, or lessons taught by individual teachers. And although each of these efforts can represent important initial steps in adoption of a more comprehensive long-term strategy, they should not be ends in and of themselves, as they're unlikely to significantly reduce bullying problems. Now, with these misdirections in mind, we'd like now to turn to highlight 10 best practices in bullying prevention and response. Support for these best practices comes from evaluations of school-based programs, but also from research and experience in the field. So let's take a look at our first best practice to focus on the social climate of the environment. In order to reduce bullying and create positive communities where youth feel safe, emotionally secure, and connected, it's important to focus on the social climate of the school, the neighborhood center, the recreation league, or any other setting where children and youth gather. Research indicates that students feel more connected to schools, for example, where they know, where they care about, and where they support one another, where they have common goals, and they actively contribute to the environment. And where students are more connected to their schools, there's less problem behavior. By working together, members of a school or other community organization can change the social norms so that it really becomes uncool to bully, so that children and youth and adults notice if children are being left out or made fun of or bullied in other ways, and so that it's normative, so that it's expected that students step in to be a friend or to help out in other ways if someone is bullied. Changing these norms in this way takes commitment, time, and effort on everyone's part. Parents and guardians, teachers, counselors, coaches, school resource officers, bus drivers, administrators, and of course the youth themselves. But it can have significant effects on behavior. Bullying also tends to thrive in locations where adults either are not present or are not intentionally looking out for bullying. All adults should be vigilant for signs of bullying and investigate whenever bullying is suspected in a school or other environment. Local data collection can help identify what are the hot spots where bullying is most likely to occur and can help to focus supervision efforts there. Speaking of data collection, let's take a look at community-wide assessments of bullying as a best practice. Adults are not always very good at estimating the nature and prevalence of bullying, where it occurs, and who it's most likely to occur among. We know from research, for example, that teachers and other staff are often very surprised by students' reports about how often they've bullied, how often they've witnessed bullying, the forms it takes, and even the hot spots where bullying can occur. So this is why the second best practice is focused on conducting community-wide assessments. These kinds of assessments can help leaders to understand what is our need for training and how do we try to tailor our training and bullying prevention strategies to meet the needs of schools and programs in our communities. Also, doing the assessment process helps to provide a baseline so that leaders can measure progress in reducing bullying over time. Now, there are various sources of information on the prevalence of bullying in schools and of youth violence in communities, including state and regional data from the Youth Risk Behavior Survey. The landscape assessment that's listed here and which is available at stopbullying.gov is a tool that can be used to try to identify relevant local data and efforts that may be currently underway to address bullying. Also listed here are 2 online resources with information about surveys that can be administered to assess bullying and school climate in schools and communities. So the first is a compendium of assessment tools on bullying, which is published by the Centers for Disease Control and Prevention. And the second is the School Climate Survey Compendium, which is a listing of valid and reliable surveys, assessments, and scales of school climate that's published by the National Center on Safe, Supportive Learning Environments. So you may want to take a look at those great resources. Effective bullying prevention requires the early and enthusiastic support from school leaders, but these efforts shouldn't be the responsibility of a single administrator or counselor or case manager at a school or after school or recreation center. Effective bullying prevention requires buy-in from a majority of the staff and from parents and guardians as well. Applying these same lessons to community prevention efforts means reaching out and getting commitments from leaders and professionals throughout the community. The action planning matrix, which is part of a community toolkit and is available on stopbullying.gov, has a very useful list of potential stakeholder groups along with relevant user guides and blogs and webinars that can help in reaching out and informing leaders and professionals about roles they can play in bullying prevention. Of course, many schools and other settings where children and youth gather are working hard not only to address bullying, but also to address and prevent other social and emotional problems. The coordinating and, where appropriate, integrating prevention efforts has been shown to consistently reinforce messages and ensure that time and energy and resources are being well spent. A coordinating group or a committee can help to combine, coordinate, or adopt prevention strategies. So for example, school-wide efforts to prevent bullying and violence have been found to be more effective when they're coordinated by safety or planning groups that represent the entire staff, parents, community volunteers, and youth leaders. A community coordinating team can include a variety of partners across many disciplines and service sectors, for example, health and mental health professionals, educators, law enforcement, and juvenile justice officers, among others. Part of coordinating and integrating these efforts is having a diverse group of stakeholders that represent the many concerns that bullying can touch. And your coordinating group should not be limited to parents and school officials, of course, but also members of the community who may not have direct contact with bullying or with students, but could have a great deal of influence on your prevention efforts. Think of law enforcement officers or even elected officials, for example. The action planning matrix on stopbullying.gov may be, again, a useful guide. It includes the action steps that various individuals and organizations can take to address bullying in communities. And here, action steps are divided into a couple of different categories. The first is raising awareness about bullying, and the second is prevention and response to bullying. These are steps to take action when bullying is either identified or to actively prevent it. So let's look at awareness-raising activities first. Examples could be providing information on state or local bullying laws, hosting a town hall or community event, helping youth develop a media campaign, for example. You see some of those listed here. Also in this toolkit, you'll see examples of prevention and response steps, which might include developing a task force to assess bullying in schools, creating a safety plan for children who are bullied, training adults on gathering and using bullying data, or establishing in-school committees. I'm going to turn it over to Erin now, who's going to pick up with our 5th best practice.
Thanks so much, Sue. Really appreciate that. You know, it strikes me, I just want to make one point about this 4th best practice. As you all are thinking about the role of the state or jurisdictional health department in all this and getting your plans together, it may be, this matrix may be a helpful tool just to do a scan. We've tried to work at HRSA to do some education around that nuance that you all know well in public health between raising awareness about a problem and kind of getting folks to the table and activating champions versus kind of once you have political will and once you have a collaborative established and you have great partnerships, you can really begin to get more into the weeds of effecting true change. So just wanted to flag that as something that might be helpful, and that's on the training center of stopbullying.gov. So our 5th best practice relates to training, which is, I think it's going to be critical. We'll talk a little bit later about state laws in particular and their role in all this, but much of what those laws put on the books is requiring training of adults. And if you think back to the very first best practice, which is creating a positive school climate, it's clear that changing social norms like that aren't going to happen sort of overnight without having every individual who interacts with youth up to date on the best way to handle those situations as they arise. They have to understand the nature of bullying, what are its effects, how might we prevent this, and then resources to reach out and touch if something does occur. And we're hopefully able to help you out with this. If your interest in bullying sort of work for your state intersects around workforce development or training, we have some tools for you that are free, that are readily available to help. In fact, you may have noticed that today's presentation started with a slide. It said Chapter 5, Misdirections in Bullying Prevention. So what Sue and I are doing today is delivering to you a section of a pre-established training material that is accessible to you all today for download. Since we met in December, we have great news that all of this training that you're hearing from Sue and me today, plus more, was launched as an online course in recent months and is able to provide free continuing education credits to many professionals out there. So that's a nice, ready to reach out and touch resource for you. We also have all this material available as a downloadable PowerPoint file that you can draw down. You could add some local or state information and customize it and have that ready to initiate delivery of training of stakeholders. There's also some great materials on stopbullying.gov around training for educators specifically, kind of how to handle this in the classroom, and then also really uniquely how to think about the role of school bus drivers. We talked earlier about how important it is to seek out support from all the different individuals and really build buy-in. And so school bus drivers turn out to be a pretty important stakeholder in all this, and so there's a training that's available for them. If you want to consider going further with that educational training lens and thinking about actually implementing an educational program, just wanted to flag for you that NREP and Blueprint are two online free searchable databases to find different degrees of evidence-informed resources. Number 6 for us at HRSA and stopbullying.gov is centered on the power of convening, the power of community events. We really think that getting the right folks at the table with the right information and being facilitated in action planning can drive a lot of meaningful change. We could see this playing out on the local level, and you could have a role in catalyzing those kind of local, it could be a town hall event, for example. But I think these principles here might also apply to your voice as a state leader and thinking about how you bring together your partners at that level. So, you know, the point of a meeting of this nature would be to develop a call to action. You certainly wouldn't want to meet to sit around and say, we all agree this is a bad problem, and then walk away. You know, it has to carry forward into a call to action. And so what we mean by that is something that actually puts onto paper specific actions for the different roles and responsibilities of your partners, and ultimately everybody getting behind the common goal of effectively preventing and responding to bullying. So again, we do have some resources for you that if this were a path you'd want to take, that we could, you can download today. One of them is a sort of a checklist, materials around what would you do before an event like that, before the convening, helping you make sure you've got all the right folks at the table, have ideas for what to do at the actual community event itself, and then some ideas for what can happen after that event to make sure that what occurs carries forward as momentum to drive positive change. So just some pictures of what those materials look like. They're all packaged in this thing called the Community Action Toolkit. Might be helpful to just peek at and look at. There's a landscape assessment tool in there to help you take stock of what is already on the ground. What I'm really respect about what we heard from you last time in December was your interest in not duplicating work that's already going on, whether it be from your sister education agency or other groups. And so I think you're all probably very busy right now taking stock of what's already on the ground. Number 7 is set policies and rules about bullying. We are able to say now that there are laws in all 50 states and the District of Columbia requiring public schools to develop anti-bullying policies. There's a lot of variation here. Definitions of bullying differ, and requirements for those policies are going to differ. I want to point you to, there's a policies and laws section of stopbullying.gov, which has a clickable map to get the lay of the land for the policy landscape for bullying-related issues. We try to keep that up to date, and there are also some resources around the Department of Education's vision for 11 key components of policies related to bullying. And so there might be some ideas that you might glean from looking at those key components and looking at what's on the books in your state. Are there gaps that could be filled? Most important regarding policies in the education setting is making sure that there are clear rules and boundaries and consequences for the bullying behavior, but that also, if you remember those misdirections, that the consequences are developmentally appropriate. We definitely don't want to see an overreaction in creating those zero tolerance policies that eliminate our chance to really drive an intervention. Number 8 is responding consistently and appropriately when bullying does happen. This is getting a little bit into the micro of what exactly should happen after a bullying incident between and among youth. So making sure that children involved are separated, obviously assuring safety, meeting any medical or mental health needs, staying calm, and modeling the respectful behavior when you intervene. So we know that in some cases, police or medical assistance might even be needed if there's a weapon involved, if there are threats of serious physical injury, or if there are threats of hate-motivated violence. So things like racism or homophobia, if there's serious bodily harm, if there's sexual abuse, or if anyone is accused of an illegal act, such as robbery or extortion. These are the kinds of things where, having those relationships and setting the stage to bring in, whether it's law enforcement or the healthcare or mental health professionals, will be important. So there may be room in your state for some education around how to appropriately respond. Really critical here are also making sure that the bullying is not ignored and that there isn't a culture of encouraging or requiring that the youth figure it out for themselves. And, there doesn't need to be an immediate sorting out of the facts. Allowing for that space to be separate is good. Certainly don't want to force children to say publicly what they saw. Remember, we want to have that trauma-informed approach and do anything we can to avoid re-victimizing youth who are victims of bullying. So along those lines, you wouldn't want to have the children involved apologize or patch up everything right on the spot. You want to take some time to think about exactly what's going on. Is this consistently happening over time? Is this a victimization that's a pattern? There's a little bit more to dive into. In addition to the other ways to respond, there's going to need to be some kind of feedback loop here often between the family and the student and the school. And so having some kind of protection plan in place as an example of a family intervention that could be scaled up through your work. Having intervention strategies for children who are bullying. Keep in mind that some of these youth who are bullying may also be bullied themselves and may have also suffered some trauma related to these behaviors. And so having, again, you're seeing this theme of trauma-informed, recognizing that kids who have been bullied, it really may have gotten to that degree of seriousness and they may need some special care to address this. So I've dropped in the file share at the top a handy document from our colleagues at SAMHSA that talks a little bit about the bare essentials of trauma-informed approaches, and I hope that ends up being helpful. And of course, you know that having referral to the mental health professional world is definitely on the table in cases that are very severe. Ninth is really emphasizing the importance of dialogue with youth, spending time talking with them about it. One intervention is just creating the feedback loop between the family and the youth specifically, and making sure that they're talking about this regularly. You can also see this play out in class meetings and having some classroom time dedicated to addressing these issues. We know that it's important for youth to talk about bullying if they're experiencing it. We don't want them to internalize their experience because we know that doesn't lead to the best outcomes. There's a great resource, two that we wanted to lift up for you. One is this youth engagement toolkit. It's pretty easy to download and print, like a 5 or 6 page document, and it sets the stage for youth, whether they be kind of preteens or teenagers, coming together, watching a video about bullying and sort of observing that behavior, and then there's a discussion guide. And the intent with this youth engagement toolkit is to have it be peer-led, youth to youth. So this is a handy tool that, if you were interested in doing some direct-to-youth work, may be helpful. Another free and available resource is SAMHSA's new app. It's called Know Bullying, K-N-O-W, and it's available for free on the iPhone and the Android market. It has conversation starters. How would adults in the lives of youth really initiate that conversation? And there's some great tips in there on how to do that. You can save profiles for different youth in your life, and that may be something that could be disseminated. That's an example of something that could be taken on by your office. We also have a handy for pretty much the teen audience, the Be More Than a Bystander interactive section of stopbullying.gov, and that's pretty self-explanatory. Finally, just want to reiterate to you all the importance that you already know of not seeing bullying prevention as a one-time, assembly, for example, or a one-time rally, and then sort of patting ourselves on the back and moving on. We all know for any public health problem that is not sustainable, doesn't drive sustainable change. So making sure that there's no end date to some of this work in a certain sense in terms of keeping it, driving it forward, and really creating meaningful cultural changes in environments that youth intersect in. So with that, I'm going to pass it over to Dr. Minkovits to talk to us a little bit about how you might bridge between these very global what works in bullying to the very concrete work that you're thinking about taking on. Thank you.
Great. Thanks so much, Erin and Sue, for all the excellent info you provided and links to many resources, which are truly fantastic for those of you that haven't had a chance to look at them yet. So now, thinking about the question, what is it going to look like for your state or territory to implement these practices? There's first the short answer. It depends. And then there's a much longer conversation that will happen in each of your teams. So I put up here a listing of some questions that you might want to consider to further the conversation as you continue to focus on strategies to reduce bullying. And the first set, I want to harken back to Sue's comments regarding the social climate. So what are some questions that you might be thinking about? Well, first you might want to know, what's the current experience in your community with regard to addressing bullying? What are the prevailing attitudes within the schools? You might want to know what % of the schools have zero tolerance policies that we've heard are likely not effective. Are preschool expulsions something that's very popular in the media currently that also informs the public thinking around bullying? You also might think about what's being done in the schools to promote connectedness, since promoting connectedness and resilience can actually help reduce the incidence of bullying. and identifying what the social norms are and what you know about them as well as the state laws. So I think, again, can't give you the answers, but I think as you start to think more about the social climate and as you convene stakeholders to have these discussions, these are likely among the questions that you're asking each other. Second, with regard to conducting a community-wide needs assessment regarding bullying, trying to learn what are other data the schools are already collecting that you would benefit from knowing more about. Are there other components of the youth risk behavioral surveillance system with data collected for children in grades 9 to 12 that may apply to what you're trying to understand? And regarding the landscape assessment tools that were noted on the stopbullying.gov website, which of those do you already have access to? In terms of seeking out support, you may be asking yourself, who are the leaders of the current bullying prevention efforts throughout your territory or state? And this may vary by geographic location. And then also figuring out how best you can identify and engage parents as well as schools and other settings where children are spending time during the day. Regarding coordinating and integrating efforts, again, finding out what prevention efforts are taking place in the community, what stakeholders are already focusing on these issues, and how might you convene them in your role as Title V agencies to help further the dialogue and contribute to the conversations and identifying strategies. As I think about providing training, I know that you want to know and probably already do within your states and territories whether or not there are trainings specific to school personnel, and do those vary by school district and community? And who actually is participating in those trainings? Is it teachers only, all school administrators, parents as well, and youth, of course? And then regarding policies and rules, again, trying to identify which of the 11 key components are being implemented in which schools might be one strategy to try to address what's currently being done. Finding out how policies that are on the books are actually being implemented, enforced, and monitored, and trying to get a sense from your stakeholders about whether or not they're perceived to be effective will surely inform your efforts for next steps. So unfortunately, I can't give you answers, but rather I think thinking about some of these best practices will help each of you think about what are the relevant questions that you want to be asking with your stakeholders and your teams as you forge ahead in honing in on the bullying prevention strategies that you want to adopt. So I'm mindful that we have lots of expertise on the call with many participants, and so really we want to open this up as an opportunity. So I'm going to turn it back to you, Ellen, to guide us in next steps.
Great. Thanks so much, Cynthia. That's really good information. Rebecca, why don't we go ahead and put up the poll question, and we urge the participants to weigh in on some of the issues that you have and maybe how we can help you. So we're going to start responding as you fill in your poll. Now, come on, I know there's only two that have, okay, good, I feel better already. Okay, you all can continue to select your answers as we start to move forward, but it's already becoming evident that there's some need here about assessing your plan strategies against the known evidence and best practices. And I think if Sue is still on the line, can you respond to that question or that, giving us an idea about that?
Yes, I will do my best. I think it's not surprising that I think many folks are really seeing that need. And hopefully today's discussion about what we know about evidence-based practices, best practices, will help you begin that process to take a look at what you've proposed, what you may want to tweak in your plans, and how that aligns with what is seen either with our 10 best practices, which are, again, very broad, or drilling down a little bit to begin to ask those questions that were just presented to you in terms of, how can I begin to think about how those best practices apply to my state?
I think one of the things that can come up is that you may, in your survey of what's going on in the state, become aware of a program that's happening, but maybe doesn't meet up with those targeted areas that we consider to be best practice. And so I think it's really important to know what those are and to be able to identify them and identify what the sources are for that information. And then what else might you do? Either Sue or Cynthia, do you have some ideas about how else you could look at those practices that may be in place that may not meet all the right standards?
So this is Cynthia. I think it's part of a larger conversation to understand from the stakeholders who may be promoting practices that may not be consistent with the material that Sue and Erin presented, to have an understanding with them about what they think is working about them, what they think may not be working, and then engaging in a dialogue to identify how what they think may be working may be accomplished perhaps more effectively or more efficiently with a different or alternate approach. But it's part of a dialogue and a conversation, and understanding that there's obviously going to be concern about sort of how scarce resources are going to be allocated as part of that.
Cynthia, that's great. This is Erin, and I would just echo what you're saying, that this sort of, the moment is an opportunity in the sense that a change has occurred. The bullying national performance measure has been selected, and there's some actions that occur because of that, and it's a very natural time for the state health department to knock on doors and to say, we're here, we're engaging on this issue, we have a role to play, and we're doing an environmental scan to understand the current landscape in our state. And if you wanted, you're of course able to use these free resources to say, we're looking at these best practices and trying to assess that against what's currently on the books and on the ground. It could be a nice catalyzing moment to initiate that dialogue.
Yeah, I think that's really important. Thanks, Erin. Are there other people on the line that would like to share some of the ways in which you might have addressed this issue? Your lines are all open. Okay, so while you're gathering your thoughts on that answer, let's talk a little bit about evaluation. That seems to be always an issue that people need to deal with, and sort of looking at your data. What data do you have that's available to you, and how will you be able to show that the information that you've collected through your data is going to be able to show you a change over time? Cynthia, you want to respond to some of those concepts of evaluation, and Sue?
Sure. So this is Cynthia. I'll start, and then Sue, if you still have a voice, I'll let you chime in as well. But I think the most important part for evaluations is figuring out what's the question that's going to most help you and your colleagues in the field and other stakeholders ultimately improve what we do and reduce the incidence of bullying and its sequelae. So I think as you think about strategies that are being implemented in support of the national performance measure, you have the opportunity to select evidence-informed and evidence-based measures to help guide the processes along the way and inform how strategies are being implemented. So I would think of those as being one tool to use And I would also think about using evaluation data as an opportunity to continue the conversation with your stakeholders. There may be opportunities as new data get released, either from state or local surveys, to again bring folks together and use data as a starting point to continue the conversation.
You know, it's been a while since we actually, some of you may remember that for a long time, YRBS did not include any information about bullying, nor did Title V offer an opportunity to do a performance measure on bullying prevention. So we really have come a long way. And many states, most states, have laws and regulations related to bullying. So we've come a long way that will allow us to put some of these best practices in place. I think one of our challenges is to help people be aware of what those challenges are and what best practices are. Maybe people can talk a little bit about what they've done to help to train people and things like that, or somebody who has already tackled one of these questions that we've put up on our poll and give us some ideas of how they work, you know, moved forward. Don't forget, if you've muted yourself earlier, that you need to unmute if you're going to share or ask questions.
This is Sue. With these questions to consider in front of us and considering and thinking back on some of the additional best practices we talked about, I would love to hear from participants. How did the best practices that you see here or that we discussed, how did they align with your plans and your ideas for your work in the state? Are they consistent with what you're planning to tackle, and or are there gaps?
I see we've got some folks writing into the chat box, so anybody want to speak up while they're writing?
You know, Ellen, while people are thinking, I just wanted to take the chance and let everybody know that in addition to so there's sort of the face-to-face, peer-to-peer TA work that's going to go on April 5th and 6th. We know that we will have another chance to meet at the skills building session on April 6th. So, you know, there's some overlap there, so we'll make that work as much as we can. I also wanted to share that we're planning to have a booth, a display at the AMCHIP rescheduled conference, and so we will be present there. So if, you know, specific questions come up between now and then, if you're not able to be at the skills building session, just know that we're going to be accessible to you there. And we'll try to make sure that any materials, handouts that are produced for the skills building session, we can have those available for you at that table.
And all of this, there are a lot of materials that will also be available on Children's Safety Network website as well. Thanks, Erin. We have some comments from folks at AMCHIP. By the way, congratulations, folks at AMCHIP, for pulling this off. I couldn't believe they rescheduled this so quickly. In schools, we have found that sometimes you need to train school personnel to model the behavior amongst each other that isn't bullying or contradicting their anti-bullying efforts. I think that's a really, really good point. Are there any tricks of the trade that any of the speakers or any of the folks on the phone might offer? Again, I think it needs to be part of the climate, as we've been talking about. How do you get everybody on the same boat or on the same page.
Yeah, it's interesting, Ellen. At HRSA, originally a lot of our work in bullying was around youth-facing materials and trying to drive change through, social marketing campaigns to youth. But we sort of zoomed out a bit, I think, in recent years and said, we can't drive that change with youth until there's a context for the adults that play a role in their life, whether they're school personnel, families, community establishments, to understand how important their role is both in modeling and intervening and setting up an environment where kids can be an active bystander, for example, and not get pushback.
Yeah. That's great, Erin. Sheila has made a really good point here in the box. While a general set of best practices are helpful, it would be very helpful to have more information about actual evidence-based interventions that have been demonstrated to be successful in the primary prevention of bullying and harassment, since many of these best practices are focused on appropriate response. Have any states or researchers implemented interventions that have actually demonstrated success in reducing bullying based on surveillance data? Sue, I'm going to throw that one over to you because I know you have experience in that too, and anybody else who wants to weigh in.
Sure, and maybe if you could back up the slides, Erin had pointed to a couple of government registries that do feature, this is the NREP registry as well as the Blueprints registries that do feature some evidence-based practices around bullying prevention. There have also been a number of meta-analyses to see excuse me, how effective are bullying prevention efforts in reducing bullying in schools. And there's good news, bad news. The good news is, yeah, we have seen success. Some of the best meta-analyses have shown in reducing bullying, and some of the programs that you'll find on NREP and Blueprints may be very helpful in that that regard, are featured in these meta-analyses. The bad news is, of course, we've got room for improvement, which is not surprising. So there's no silver bullet in any single program, but yes, there are a number of, I think that the key is comprehensive school-wide efforts that really embrace these best practices that we've discussed that have shown some positive effects. Excuse me.
Thanks, Sue. That's great. And this is Erin, and I'll just sort of piggyback and say, Sheila, I think you're really, hitting the nail on the head here with your question. This is kind of the heart of the matter. And as Sue said, we have some answers. We don't have all the answers. But I'm really eagerly awaiting next month the anticipated release of a consensus study by the National Academy of Medicine, which is kind of previously known as the IOM, the Institute of Medicine. We've collaborated with some other federal partners and some private sector groups, the Robert Wood Johnson Foundation, to pose that question in a sense to key experts in the field, and they're planning to release their recommendations to us around how to apply the evidence that does exist. And so that'll be coming out ideally late April, and so we will absolutely be alerting you all when that's released, and hopefully that'll also provide some clarity.
So let's take the last 2 minutes and focus on Tomei's question in here because she was so good to put it in. Colorado is focused on shared protective factors, specifically building life skills and school connectedness to leverage existing resources, partnerships, and mobilization efforts to de-silo violence issues. Excellent, I love that, de-silo. This also opens the strategy options beyond evidence-based programs that have only been evaluated for bullying outcomes. And while we are starting out with the focus in schools, we hope to expand strategies beyond schools to the community at large. And that's great. I mean, that's what we want. We want a school community, an everyday community to be bully-free. Any other thoughts? We're about ready to close. We really appreciate your time to join us today, and all this information will be available to you. As you can see, the PDF of slides is up there, and we have the document that Erin put up from SAMHSA, and the recording will be sent to all of you. So feel free to write us more questions as they come up to you. Erin's just also put up another resource on connecting the dots, which is great, and it's related to Colorado's approach. Fabulous. Thanks, everybody. We hope that we'll see some of you at AmChip's workshop, and we'll see some of you maybe at the Safe States Alliance meeting coming up. So have a great day, everybody.